Hi, it's Randy Rolfe from the Institute for Creative Solutions, sharing foundational concepts about vibrant health through natural living. And the Bloomberg City Lab ran a couple of fascinating articles about human architecture and the relationship between epidemics of tuberculosis in the late 1800s and then Spanish flu in the early 1900s, and how that influenced architecture. Because what they found, this was long before antibiotics, and what they found was when people were exposed to nature, they recovered better. And if people had a lot of exposure to nature, they didn't have as serious symptoms in the first place in general. So I wanted to read you this one um, paragraph that some of what we think of as the Scandinavian architecture was actually in response to these experiences and the belief in Europe that, and it also hit in the Adirondacks here in America and in the Saranac Lake area, that if people had an infection, to get out in nature and being exposed more to fresh air, to greenery, and to the sun, and also to the earth, that they would heal faster and better. And so in Finland in 1932, the Alvar Aalto Paimio Sanitarium was founded, and the idea was for people to be able to leave their rooms and go and sit out in the sun and enjoy fresh air and greenery. And it said 52 years after the Paimio opening, some of the first empirical research was concluded on the effects of nature on physical healing. The environmental psychologist Roger Ulrich looked at hospital patients who had a room with a view of a leafy green landscape. Published in Science in 1984, his study found that when all other aspects of their care were equal, the patients with a window that looked out onto trees had fewer surgical complications, healed faster, and required significantly less pain medication than those whose windows faced a brick wall. Isn't that fascinating? Visit many newer hospitals today, and you'll see instances of integrating nature into the healing process, whether it's an atrium full of natural light or patient rooms overlooking a green space. So we're supposed to be in nature, and it's really only since the Industrial Revolution and so many people crowding into cities, being close to their jobs, factories and offices, that we spend so much time indoors and sometimes can't look out a window. I've got two windows here in my office that they're just totally green, and my bedroom in my childhood, I just loved it because when I lay in bed, looked out the windows, there were these beautiful weeping willows. That makes a huge difference. And if you can get outside, you know, a lot of the recommendations today with our current epidemic are to get outside. Sorry about that. And get outside, get in the sun. They also called it heliotherapy back in the 20s and 30s, was to get some sunlight. And we know that sunlight helps create vitamin D in the skin, and it helps normalize our hormonal, our daily cycle of energy, sleeping at night, waking up during the day, and all our organs coordinate with that schedule. So it really helps everything work together. So there's so much more I'd love to share about those articles, but we know that nature can help us stay healthy. That's it for today. Thanks.